Well, good afternoon, and thank you all for joining us today for our roundtable event. Today's presentation is about OSHA requirements in COVID-19. Our speaker is J. Larry Stein, who is a senior principal with Wimberley, Lawson, Steckel, Schneider, and Stein. He kind of ribbed me about introducing him with that long name, but I went for it. J. Larry is known nationally for his expertise in OSHA wage and hour laws, and he's got a lot of great information to share around this issue in particular, so I think you're going to get a lot out of it. Before we get started, I wanted to just tell you all how the next hour will go. We're going to begin with our presentation. If during the presentation you have any questions, please enter them in the question box, which should be to the right of your screen. You should be able to see that. Just enter any questions as we go along, and once we get finished, J. Larry will go through those questions and answer them. And then once we've answered all of those questions, we'll head back to the lounge, and you'll be able to talk directly with J. Larry if you would like to. You can also chat with other attendees. So I'll give you some more information about that once we go through the presentation. So we're going to get started here. It'll take just a minute to load.
Hello, everybody. It's nice to meet you remotely. We're going to be talking about COVID-19. It's a pandemic, but don't panic. Help is on the way. I've been giving these presentations since March. Back in March, I told people I felt like I was drinking from a fire hydrant. I would like to tell you that it's different, but it's not. I just feel like I've been drinking from a fire hydrant every day since March. Continues to change, sometimes daily and sometimes very confusingly, like the CDC guidance on if you're fully vaccinated, you can go where you want, basically, versus other portions of the government. We'll talk to more detail, but just to illustrate that this thing continues to have a change. Now, one of the things I wanted to look at is just some data. I just want you to look at some numbers I pulled off of some sites just to get a feel for what's going on. So here is the CDC numbers from January of 20. I will tell you that I went to go update this chart a few days ago, and lo and behold, this chart is no longer available on the CDC guidelines, which is kind of telling on itself that CDC decided to take this chart off. I have another one from another source to bring it up to date, but I wanted just to take a few minutes to look at the data and explain a few things that impacts upon manufacturing facilities. And you can look at the bottom right-hand corner, and you will see that there's a red box, and it shows death, total percentage of COVID deaths. The percentage of it from 65 and older is 80.9%. Well, what is the significance of that? Well, the significance is that in employment situations, the number of employees that you have over 65 is extremely limited, whereas this COVID has been particularly deadly for senior citizens like me. I'm fully vaccinated, I'm fine. But look at the other numbers, and I'll just take a moment to look at some numbers. For example, if we look at the 0 to 17, you will see that the percentage of total deaths for 0 to 17 was 157 nationwide for a whole year, a remarkably small number. Here's a percentage of the total COVID deaths, the 0 to 17, which is basically high school and younger, is 0.05%. In other words, 99.95% of the deaths were in age groups not for the high schoolers and younger. And quite interestingly, if you look at the percentage of total deaths, which the CDC had, 0.549% of the total deaths were from COVID. In other words, there's a 99.5% chance that if you were in the 0 to 17 and had a death, it was for reasons other than COVID. So it just informs you a little bit on your risk. And like I said, I went to go pull it and bring it up to date to the time I pulled this chart a little earlier, getting prepared for it, and CDC no longer carries it. But as you can look at this bar chart, you can see the total number of deaths from January to now for 0 to 17 is 287, 18 to 29-year-old, 2,163. You get the feeling when you look at it that the number of people who died from this area is not very large until you get to 65 and older. And the other thing is, as you probably have heard, and you may have personally experienced, I know I have, that the people that I've been aware of who died had comorbidities, morbidly obese heart. So keep understand the risk that's involved. So one of the questions is, should we get vaccinated? And the short answer for me and to you is yes. I will say I have been vaccinated. I got vaccinated and followed my vaccination March 15th. Now, as of May 21, about a third of the U.S. adults are fully vaccinated. About 45% have received one dose, and now the vaccine supply exceeds demand. Now, what do you want to do as an employer with the vaccines? Well, as an employer, I think it's to your advantage to have as many people vaccinated as possible. So what should you do? Well, the way we do it is we do not recommend that you mandate vaccines. EEOC has come out with a ruling that you may. However, there are other liability issues in addition to just employment discrimination under the Americans with Disabilities Act. And it seemed to be drawing consensus in the legal community outside of perhaps the healthcare facilities, not to mandate vaccinations, but to encourage them. So what we're seeing is employers offer paid leave, free transportation, and other incentives. Some of them just do information and education campaigns. Some of the bigger ones will actually host community vaccination clinics, and others offer cash and other incentives to employees who vaccinate. So we urge it, but don't make it mandatory, mainly because of the health inquiry issues you have. I'm not worried about HIPAA. I know some of the attorneys will tell you they worry about HIPAA. But with the way HIPAA is set up, asking them to be vaccinated is not a problem. Your problem comes when you start asking for the paperwork for the HIPAA violation, not the asking. The ADA is the one that prohibits you from asking, and the EEOC has given us an excuse and said we can do so for the time being. And frankly, the EEOC says you can mandate the vaccinations, but we're a little hesitant. I'm a little hesitant to do it. I will tell you, for example, I had a client who basically just offered $60. Anybody wanted $60? All they had to do was come in and show they've been vaccinated. And well, what does this employer know? Well, this employer knows that everybody who's been vaccinated, who's not, because pretty much everybody wanted the $60. Now, let me talk about the incentives and a wage hour issue. If you pay them cash like my friends did in this thing, you may end up having to pay overtime and include it in a regular rate. Why? Because you're giving a bonus or a payment to incentivize them to do something you want them to do for work. And it may have to be included in the regular rate and overtime if it's given in a week in which that employee works overtime. What I have recommended, and some of my clients follow me and some don't, is to give them some extra hours of pay. For example, if your people are making $10 an hour and you want to give them $50 for doing it, you can simply say, I will give you 5 extra hours of pay on it. And so when you put it into your system, you just put 5 hours of pay. That does not have to be included into the overtime rate unless you want to, but if you do, it just makes the calculations a whole lot easier if it happens to hit an overtime week. It's a small technical point. I doubt wage hour is going to be doing much about it, but it is a possibility and you at least ought to be aware of. Okay, now what federal regulations apply to COVID? Well, the short answer is OSHA has adopted no permanent COVID rules, but existing rules do apply. We'll talk a little bit about that. And the agency has published compliance guidelines. However, President Biden has issued an executive order to OSHA to issue what's called an emergency temporary standard on COVID. And that has finally been done. Here we are in May. That was supposed to be done in March. And they're still having debates in there. Well, mainly because what do you do now that we're kind of outside the crisis? Everybody's getting vaccinated and we're on the end of it. What do you do with an emergency temporary standard? OSHA is very concerned, and they rightly should be. If they file the emergency temporary standard, they're going to get sued, saying the emergency is basically over. My belief is that it's going to be issued. If it's going to be issued, it's going to be issued very shortly, and we'll let you know as soon as we hear whether the ETS is done or not. That being said, OSHA does not have lack of tools to do that. They have certain regulations that apply. First one's the OSHA's personal protective equipment requirement. And that one is the one where they can try to use it for respirators. Now, you're thinking, okay, surgical masks, they're respirators. Well, no, they're not. Under the OSHA personal protective equipment, the first level at which you get to be a respirator is an N95 mask. Now, to the personal protective equipment, they can try to say, hey, you need to wear a surgical mask, a cloth mask. And that's what they've been saying. And they've been saying you need to do this in accordance to the CDC guidelines. And of course, the CDC guidelines have recently just changed to say, if you're fully vaccinated, you don't need a mask. Indoor, outdoors, small group, large groups. And so that becomes a major play on the general duty clause and the personal protective equipment. Now, if you have done personal protective equipment, I'm going to tell you from experience, because I've handled 10 OSHA COVID-19 investigations in the last 12 months. I only had one client cited for it, and it's because for the test takers, they did go out and decide what personal protective equipment to use. So OSHA comes in, our test takers are all decked out in smocks and in goggles and in masks and gloves. And my client thinks, well, everything is wonderful. Well, OSHA cites them because under the personal protective equipment, and this may come as a surprise to you for all your personal protective equipment, but the requirement in the OSHA personal protective equipment is that you review your personal protective equipment annually and you certify that you have done so. Well, because we did the new changes for the test taker, which was a new job, they cited us for not doing the annual certification of the personal protective hazard assessment. So if you're out there and you got personal protective equipment assessments for things like goggles and gloves, and you don't have an annual certification, you might want to seriously consider, you got to do a hazard assessment, you got to do it annually, and you got to certify it. And that includes your COVID choices you've made. As to the general duty clause, OSHA's been taking the position that they will be enforcing the CDC's general guidances. For the most part, the only place they have issued the general duty citation so far has been in the healthcare industry. But it is a debatable issue legally for a lot of reasons, which I think is beyond this seminar. But if anybody's interested, ask me. I'll be glad to take you into the weeds on that. But it is not a good thing, and one reason why they were considering the emergency temporary standard. Also, they can use the OSHA bloodborne pathogen to a limited degree if you're getting exposed to different types of bodily fluid. The bloodborne pathogen definition, by the way, is not limited to just blood, but basically human fluid tissues. Those are the things we're seeing for citations from OSHA on the federal level. Do any states have their own COVID-specific health and safety regulations? Short answer, yep. Virginia, California, Oregon, and Washington have adopted temporary standards. And like I told you, things keep changing fast. Virginia has now taken that temporary standard and made it a permanent standard. So there's a little difference on the slide, but if they're in Virginia, you need to look at the new permanent COVID standard. California, Oregon, and Washington are still with temporary standards, at least as of today. If you have questions about that, I think you need to look into those for the state, because there are different, they do require some pandemic planning, some written plans. But they would only be in those 4 states if you have a plant in those 4 states. What OSHA record keeping requirements apply to COVID related illnesses? Well, the short answer is the same rules apply as always. Now, what does that mean? I realize that's kind of meaningless to you guys. So what the rule is for OSHA record keeping for COVID illnesses is the first thing that you have to determine is the COVID illness work related? And that's the critical question. And the issue for most places is it's kind of a problem because it's a community-based illness. I'm certain all of y'all have heard in the studies that about 80% of the infections have been traced to the homes, not to the workplace. So what OSHA has said in an enforcement memorandum on doing the COVID thing is you need to ask the person with COVID certain questions about their activities to determine whether it's a community-based illness or a work-related illness. So basically what I suggest is when you have an employee who's got COVID, that you have sit down and have a short conversation with them. It doesn't have to be long, and ask a couple of questions. Do you live with anybody else at home? Have you gone to the grocery store? Have you gone to the pharmacy? Have you gotten out and pumped gas? If the answer to those questions are yes, then you can't determine that it's a work-related illness. I will tell you that I told my clients this repeatedly during the entire time, and I finally got one guy. We asked the question, you live at home? Nope. Do you go to the grocery store? Nope. Do you go to the gas station? Nope. Do you go pharmacy? Nope. I go home, I go to bed, I eat, the pharmacy delivers things to my door, the grocery delivers to my door, and all I do is go back and forth. We record it. But until you get those type of answers, you don't have to record it. As long as you document that, OSHA is not going to cite anybody for that, but you do need to ask those questions. I will tell you some employers, very large ones who are publicity shy, just made a categorical decision to record all COVID-19. That is not required. They didn't do it for OSHA purposes. They did it because they're very brand sensitive and did not want to have any fights over the brand. And that's a different issue and one outside my purview. But from a legal point of view, ask those questions. If it turns out they're out and about in the community, then you can make the determination that it's not work related. If it becomes work related, in all likelihood, you will have to record it if you get the type of answers that I got from my one client. Now, what is OSHA doing on enforcement? Well, I went back a little earlier and checked the citations, and from December 24, 2020, OSHA has issued citations from 294 inspections for violations related to the virus, resulting in a proposed penalty totaling $3,849,220. A little precise, but that's what the numbers say. And well, how many of those were types of places like businesses? Almost none. About 90% plus of those citations were related to healthcare facilities, doctor's offices, clinics, hospitals. They haven't really cited hardly anybody. There's a few. You can count them on a couple of hands, but they have actually cited employers for COVID violations outside the healthcare industry. So what can you do to keep up with COVID cases in your facility? Well, the reason I asked that is because some people and some HR really wanted to keep up with the COVID cases in the facility. Sometimes it was because the healthcare department comes in and says, we need you to help us keep up with COVID cases in your facility. Well, there's a couple of ways to do it. And one of the easiest ways for most everybody, particularly if you're fewer than 500 employees in your facility is that you can let them know that you will pay for the first 2 weeks of COVID leave. Now, up until December 31 of 2020, it was mandatory to pay for those first 2 weeks of FMLA COVID leave. You had to pay it full pay. But there was a direct tax credit from your Social Security. Congress has extended that in a voluntary aspect. And the last time I checked the date, it was through, I'll have to go back and check that. But it was through at least June of this year, where you could voluntarily give them 2 weeks of pay for COVID FMLA, and you get a tax credit. Well, in order to get the tax credit, you've got to have the sufficient documentation to demonstrate that it was for COVID. And because it's business related, you can ask them under the FMLA regulation to provide you documentation that they're out because of COVID. So if you really want to do it, you can do it. You pay the money out, but you'll get the money back on a straight tax credit. If you're big enough, you just file the tax credit on your your form to the Social Security where you're going to pay your quarterly taxes and take a credit right off of that. If you're small and it exceeds the amount of Social Security that you have to pay, you can make a tax refund and you will get that money back. But it helps you keep up with the COVID cases. Now, some of us want to keep up with the COVID vaccinations, like I talked. My recommendation is to give them some sort of incentive to give you the information they get the vaccine, and that way your HR department will be very knowledgeable in what is going on in terms of getting the vaccination and going on from that point. Can workers collect workers' compensation for COVID-related illnesses? Well, I'm going to give you a real lawyerly answer. It depends. Now, if you've ever called your lawyer 4 times and you give them a question, if you haven't gotten the answer, it depends on once or twice something's wrong with your lawyer, because that is the most lawyerly answer you'll ever get. It depends. So why does it depend? Well, because the states have different rules for workers' comp, and some have reacted differently to this COVID. So 17 states and Puerto Rico have extended workers' compensation coverage to include COVID-19 as a work-related illness. 9 of those states have enacted legislation creating a presumption of coverage for various workers. Now, that mostly, for the most part, that's been health care workers or people who have to work very closely together, shoulder to shoulder type operations. As you see, 3 limited to first responders and healthcare workers, 3 covered all essential workers, and then 2 have covered all workers. 4 states have used the executive branch authority to implement presumptions for first responder and healthcare workers, and 4 states have taken executive action to extend coverage to other essential workers like grocery store employees. Well, what does that mean? Well, it means I can't answer the question because I got to know what state and what does the employee do. So if you have somebody that's out for COVID-19, can they file workers' comp? Requires looking into your own state workers' comp rules and how governments have applied to that. Let me know if you have a specific question, perhaps we can help you. Sick leave. Can workers take FMLA leave for COVID-related illness? Well, the short answer now is yes, to the same extent for any other illness or injury. As I alluded to earlier, that rule was different prior to December 31, 2020, in which it was mandatory for a lot of employers who were under 500, which is kind of interesting because the FMLA typically doesn't kick into coverage until employer has 50 or more employees. That coverage is no longer available. Like I told you, you can get the tax credit for giving them COVID leave. As of now, you still have to be over 50 employees for FMLA, but if they're out for an illness, it will qualify for FMLA leave, which is an unpaid leave, and so you can make it unpaid leave for COVID-related illnesses. So, hey, there, I told you I was trying to figure out what the tax credit was, and lo and behold, there it is. It's September 30th, 2021. Okay, we got some more economic challenges from the COVID. One of them is motivating employees to return to work. I will tell you, back in March when we passed the unemployment supplement to $600, I told everybody on the webinar at that time, you're going to have a very hard time getting employees to come back to work when they're making more money on vacation than they are working. Even with the $300 federal supplement, which runs out on September the 6th. So as you've probably been hearing on the news, some states are ending the $300 federal supplement early, some will not. If you're in a state that's not, your applicant flow will start increasing on September the 13th of 2021. You're probably going, why September 30, 2021? How am I so certain about that? The last supplement check comes out on September 6th. 7 days later, when they don't get that supplement and all of a sudden are getting a tiny little bit of money, that's when they'll go, oh, I've got to go back to work because I'm now not making enough money to live. Just to let you know, unless you're in some states where they're eliminating, and by the way, 19 states as of today have stated they're stopping the $300 supplement for that very reason. But there are other issues in addition to that. Some employees are just scared. They've been way so long that they're just scared to come back to work. You will have to work to motivate them to come back. Some of the other ones, and I'm having conversations evaluating remote work locations, some employees have gotten very, very comfortable wearing their sweats and their t-shirts at work every day and no makeup or no shaving, depending on what you want to do. I don't wear makeup, I do shave. Yeah, I know, big surprise. But coming back to work, some of them are very reluctant to leave the remote work option. Some employers are finding that that works for them, and other employers are finding they're not. And it's just a decision that you're going to have to make for those remote workers, whether you want to continue to do so and it's advantageous to you and seems to be working, or it's not and you need to bring them back. Also, as you know, in economics, we got pent-up demand and lagging supplies. Well, we don't have enough workers, and believe it or not, the amount of savings we've had during the pandemic has been astronomical. So there's a lot of pent-up demand and lagging supplies, and you can see it from the last 2 months of their consumer price index. It's resulting in some increase in unexpected increases in the consumer price index. New administration compliance initiatives. Well, the most recent one I want to talk about is the CDC fully vaccinated. You can go to work. You can go anywhere you want without a mask, large group, small group, indoors, outdoors. Well, that causes some problems because a lot of us have been having all our employees wear masks. I will tell you from the get-go, I talked to a large number of safety professionals, looked at the scientific evidence, and came to a pretty conclusive opinion that masks are not effective unless you wear an N95. N95s and respirators are effective. Surgical masks, the studies seem to be about 50% effective, and your cloth masks are a whopping 2%. And yet, I will tell you, I recommended every client have their employees wear a cloth mask, surgical mask. And the reason not being that it protected them from COVID-19, but it made them feel comfortable. It made them feel psychologically safe. And you still have that particular issue, and you have an enforcement issue. Some of your people are fully vaccinated and do not wear masks. Some of them are not, and supposedly are still supposed to be wearing their mask. How do you enforce it? Well, You can enforce it in two ways if you want. You can go ahead and follow the CDC guidance and saying, okay, everybody that's fully vaccinated, you can take off your mask and you don't have to wear them, but everybody else doesn't. How are you certain? Well, you're not necessarily certain. You can use the honor system. Who knows? We don't know yet. And that's one of the areas of uncertainty. Can you make them wear a mask even if they're fully vaccinated? Yes, you can. You do it all the time. For those who have noise problems in their plants, oftentimes noise problems in plants are in one area and not another, so there's some quieter areas. And yet in most plants I go in, you're making them wear hearing plugs in the entire plant. Well, why do you do that? They're not required in certain areas. Well, you do it for administrative ease of enforcement. So in order to have it administratively easy, you have certain ones, can wear the earplugs, well, but you make them all. You can do the same thing with masks. You can basically have a rule that says everybody's got to wear the mask because we're for administrative ease. Even if you're fully vaccinated, we're not. Now, that's my advice for the time being. If you ask me in 2 weeks, it might be different depending on how the vaccination rates are going and how the emergency temporary standard comes out and what CDC does. In other words, we still get to drink from a fire hydrant for a little bit longer. So I have gone through the COVID-19 issues rather rapidly, and there are a whole lot of issues. I wanted to leave some time for some questions and answers, and we can do that. I do want to make one point, though, just as before we get into the Q&As, is that part of the benefit for being a Wood Component Manufacturing Association member is that we do take phone calls from you for a short period of time. We define that as 10 minutes or less at no charge for simply being a member of Wood Component Manufacturer. Just let us know. We'll put it down. Now, if it's more than 10 minutes, we'll talk about what we're going to do and how you want to go and whether you want to proceed or not. But I just want to let you know that is an added benefit to being a member. Now, are there any questions and answers? I'd be delighted to answer those.
Great. Thank you for that. We do have a question from Leon, who is in Georgia. The first part, and you might have answered this a little bit, you touched on it, but he says, his employees are asking when can they lift the mask rule. Right now, they are requiring masks to be worn in the production area, the shipping, and the front offices, unless a person is in a private office with the door closed. And then he also said that they are currently taking temperatures. Is it time to stop that, or can they get rid of that activity?
Well, as to the wearing the mask, in Georgia, the governor has issued an order that you're not allowing what they call vaccine passports. So yes, you can say if you're fully vaccinated, you can remove the mask and you're going to go on the honor system because it's illegal to require them to show you the vaccine card in Georgia. About 20 states have already done so. And that's one reason I was talking about drinking from a fire hydrant. I mean, that's something that's happened in the last 2 weeks. About 20 states have said no vaccine passports, which means you can't ask for the vaccine card. And there's HIPAA issues about it. So the answer is yes, you can. You can go to an honor system. I will tell you, I've been in investigations with OSHA compliance officers lately, and they get so tired when we're doing interviews trying to talk to the mask, they have taken them off to ask questions because it's hard to interview with you wearing a surgical mask or an N95. I hope that's a short answer, but yeah, you tell them that they're fully vaccinated, they can take the mask off, and you're going to depend on them on the honor system.
And what about the temperature taking?
The temperature taking has never been mandated. It's always been accepted. The EEOC issued a guideline. Typically, taking temperatures is a medical test that's prohibited by the ADA. But EEOC issued a memorandum back in early 2020 saying we're giving you an exception because of the pandemic and the national emergency. The weird thing is as soon as that national emergency is over, everybody has to stop taking temperatures. And what's real interesting is, some of these people have invested a lot of money in technology to take it with infrared. They have to turn them off. They can't use them anymore because it'll be a violation of ADA once they issue it in the in the emergency. So no, you don't need to take the temperatures anymore. You can let them in.
Great. Okay, are there any other questions? I don't see any here. I do want to let everybody know that we've got some upcoming events similar to this. In June, we have a presentation from Weinig about machinery maintenance, and that's going to be a great opportunity to have, you know, your plant managers or your machinery people get on an event like this, and just it's a high-level machinery maintenance discussion. And then in July, we have a topic that I know every single person in our industry is struggling with, and that is supply chain and lumber issues. So Judd Johnson with the Hardwood Market Report is going to be joining us to present on that topic and give us, everybody, you know, the latest information about this issue. So you'll be getting updates as we get closer, so make sure to check your emails. And also after this session, we will be sending out a survey about the event. It's really helpful when we can get some feedback from attendees on, you know, any feedback is great feedback. So please take just a few minutes out of your day to fill that out and keep us posted about how things went. So we're going to head to the lounge now. Jay Larry will be seated at table 1 if you want to have a specific conversation with him. Otherwise, you can, and in order to take a seat, basically just click on one of the chairs. If you want to just click, you know, chat with other attendees, go ahead, click on a chair and join in, and we'll have a quick discussion, and then we'll be through. I appreciate you joining us today, and we'll go to the lounge now.